Hi, everyone. Thank you for joining today. My name is Dr. O'Byrne, and I'm one of the physicians at Health Nucleus. And I am delighted that you have joined today to hear my lecture about sleep. So without further ado, we will get started. So there's two different types of sleep that and actually there's even more categories in terms of the non-REM sleep, but there's two big broad categories. One is rapid eye movement sleep, and that's termed REM. And then the other category is non-REM. It turns out that actually all of the stages of our sleep can be associated with some type of dream activity. But the rapid eye movement sleep is most predominantly with our most vivid and dramatic dreams. Non-REM sleep is associated with what we call deep sleep, and there's 4 different categories associated with that. There's an interesting misconception that many people have actually, where we think that the REM sleep is not quite as important as the deep sleep or the non-REM sleep. And actually that is absolutely not true. It turns out that both types of sleep are absolutely essential for both our physical health, our cognitive health, and our emotional health. It's true that it seems that our emotional health might be more dependent on REM sleep, and our restorative health might be more dependent on deep sleep, but both are actually incredibly important. What we want to do is optimize our sleep, as this is not an all or nothing phenomenon. So in other words, if you really do feel that your sleep could could use some improvement, and you're able to make some changes in the way that you live your life, for example, and you make those improvements over time, even if it's not perfect, you are going to be getting a lot of benefit from that. So the 4 pillars of optimal sleep are regularity, that's consistency of your sleep schedule. There's continuity, and that's being able to stay asleep during the majority portion of the night. That has to do with perhaps sleep interruptions, and we'll talk a little bit more about that. The actual quantity of sleep that you're getting, that has a lot to do with your sleep opportunity and whether or not you're actually allowing yourself to have that sleep opportunity. And then there's the quality of the sleep, which is really important as well. Sometimes that actually can be negatively affected by certain drugs or even medications that we're taking. Oftentimes we're taking an antidepressant, for example, or maybe we're taking something for ADHD. That can also impact the quality of our sleep. And then, of course, the other side of the coin is what other types of medicinals might we be taking to, use as sleep aids, which actually can impact the quality. There's a lot of question about whether or not somebody truly has insomnia. So the definition of insomnia for a medical profession might be different from our kind of colloquial understanding of insomnia. But basically, if somebody has at least 3 days a week where they take at least 30 minutes to get to sleep or 30 minutes to resume sleep if they've woken up during the middle of the night, and this has been going on for at least 3 months, they would qualify for a diagnosis of insomnia. Oftentimes when somebody is not getting enough sleep, it may just be simply that they're not giving themselves the sleep opportunity, that they're not actually prioritizing sleep the way they should. I guess if I had to pick out, they're all important, but I guess if I had to pick out maybe some of the most important things, it could be the sleep hygiene issues of the darkness of your room, the temperature of your room, how consistently you are making yourself get up the same time every day can be incredibly important. Making sure you're giving yourself the sleep opportunity to prioritize sleep. Stimulus control is really important as well. So oftentimes what many of us will do if we're having problems in terms of sleep interruptions and we're getting up at night, we're going back to bed and we are trying to get back to sleep for too long a time. So the rule of thumb, for example, is that you can certainly try and go back to sleep if you've gotten up to urinate or if you've just woken up for some reason for maybe 15 or 20 minutes or so. But once that time has gone by, you need to get out of bed and you need to go somewhere else. You need to listen to quiet music or do some relaxing breathing or read a book. And then once you're really tired, go back to bed. So our brains are very associative organs. We tend to associate, even if it's subconsciously, certain places with certain activities. Your bed really only should be for sleeping. And if your brain begins to associate your bed with laying there being awake, that really is what you're going to be doing. So that pattern definitely needs to be broken.